Pregnant moms, how many times have you left one of your appointments feeling anxious or uncertain? Or maybe that was you 6 months ago and now your child is already here struggling with colic, reflux, sleep issues, or other challenges. In this video, I want to open your mind to how your pregnancy experience is directly related to your newborn's health. It's so often where those problems actually start. Listen, the modern pregnancy experience with its constant monitoring, testing, and fear-based messaging creates chronic stress that doesn't affect just you, it directly programs your baby's developing system. This isn't about guilt. Please hear that. This is not about guilt. It's about understanding what happened so that you can understand what your child actually needs and how you can get to the root cause of those issues. Pregnancy has changed a lot in the last few decades. You're going through pregnancy and you have 12 to 15 routine appointments, multiple ultrasounds, blood draws, glucose testing, non-stress tests if you're deemed high risk. It's constant monitoring, and that sends a message that something could go wrong at any moment. You're also probably familiar with this book, right? What to Expect When You're Expecting. One of the most common gifts at a baby shower, but honestly, guys, I feel like this would be better used to start a fire, right? Rip up the pages, throw them in the fireplace. You'd be better off using it for kindling than using it for empowerment and using it for education in your pregnancy, because that's not what it's for. We're treating pregnancy like this disease that you get diagnosed with, and you just hope to make it out the other end alive. It is creating more stress than it's supporting. And that's not how we should think about this season of life. This shift in perspective, this shift of way we handle and support moms through pregnancy has led to moms feeling more anxious and kind of on an island in that pregnancy journey. What that is doing is directly affecting their newborn's development. And I want to get into the weeds on that a little bit with the development here and how that affects that baby's neurology. But what we're seeing and what some of the studies show is that babies are being born with more reactive against kind of the self-regulation capacity. They're not able to calm and regulate themselves. Their nervous systems are at a higher state. They're a higher reactive state when they had a mom who was under prenatal stress during that pregnancy journey. And that's something that matters a lot, right? It's not just about you as a pregnant mom. It's about what is going on with that developing newborn. So, mom's stress during pregnancy is not just an emotional experience, it's a biological reality. Their HPA axis, these pathways in their brain and in their nervous system, are releasing cortisol, they're releasing adrenaline. And those things are okay in short bursts. That's what it's designed for. It's designed for you're in the woods and you see a bear and you gotta run away. It's not designed to be stuck on. It's not designed to get locked into stress mode and stay there permanently. That's when there's these long-term challenges that show up. And what's basically happening is the baby's baseline, that infant's baseline or their normal regulation function becomes heightened. They startle more easily and they struggle to calm down because they end up having a overreactive amygdala. They end up struggling to learn and to have emotional regulation because the volume of their hippocampus when it's developing ends up being a little bit smaller. The vagus nerve develops with low tone because they're in that chronic stress response. All of this builds, all of these different factors are contributing that leads to a kid who is stuck in survival mode. They're stuck in sympathetic overdrive. Their nervous system is locked in fight or flight. And so all of our normal development functions, rest and digest, sleep, eating, but basically, guys, baby life is simple. It's eating, sleeping, pooping. All of those functions get shut off when that fight or flight or that sympathetic mode gets turned on. And here's what I want you to understand. This is the most important piece of this. They do not grow out of it. Kids do not grow out of these challenges. They just grow into the next version of them. The labels change, but it's the same foundational neurology. And what that story looks like for so many kids is you're born, you have that either pregnancy stress, birth trauma, and your system's locked in fight or flight. So it's a colicky, reflux, constipated, unable to latch, unable to feed well baby. And they get stuck in that pathway and they grow out of it, right? Because that's the best advice you get from your providers and your pediatricians is just hang in there, mom. They'll grow out of it eventually. But they grow out of it into the next thing. They grow out of it into maybe more constipation or ear infections. And they grow out of those ear infections with a whole bunch of antibiotics and maybe surgery to put tubes in. And now they have some sort of other chronic immune challenge. Right now we have tonsils and adenoids inflamed or upper respiratory challenges, or you're getting a little bit older and you have the motor and the speech delays that are starting to be seen. And you're noticing that it's not just that eating, sleeping, pooping, gut immune regulation that's affected, but it's neurodevelopment too. And they're having sensory issues, focus and emotional regulation challenges. Maybe by 5, you're seeing the ADHD signs. By 10, they're starting the anxiety. Guys, the labels change, but it's the same pattern. It's the same underlying stuck in stress, stuck in survival mode neurology that is at the root of all of it. And so the last thing I want you to do is just cross your fingers and hope that they grow out of it in that next season, in that next phase. unless you address the cause, unless you affect and address that underlying foundation of the nervous system, you're never going to get to the bottom of it. And that's what this is all about. What is the different path forward? Fix the foundation first. Imagine if you were building a 20-story skyscraper, you wouldn't be able to use the same foundation as if you were building a 1-story ranch. But those early life exposures in prenatal experience and then that first year of life, that is the foundation. That is the neurological architecture of their brain. And when those stresses and those struggles happened early on, the foundation is weakened. The infrastructure of that neurology is behind the 8 ball. And so when you try to build those higher level functions on it, emotional regulation, focus, it falls apart. You end up in these struggles because they don't have the supportive infrastructure and foundation that they should have had in those early starts to life. So yeah, the diet, the supplements, the behavioral therapy, the OT, the sleep training, all the other stuff that you're doing, it might help a little bit, but when you don't address the nervous system, you're not going to get as much out of that as you should. You're going to be fighting an uphill battle. You're going to feel like you're swimming upstream because the kid's system is stuck in fight or flight. And yes, moms and dads, this applies to you too, right? No matter how old you are, the same foundational neurology can be keeping you stuck and keeping you in fight or flight. So what is the solution? How do we get that foundation repaired? That is what neurologically focused chiropractic is all about. For us, it's so frequently pediatric focused, right? The majority of Thrive is pediatric patients, it's kids. That is where we excel and that is where we specialize because we need to unwind these stress patterns and this fight or flight mode that's been stuck in for so many of our kids so that foundation can reorganize and rebuild like it's supposed to. A huge part of that is our scanning technology, right? When someone comes in for that initial visit and evaluation, and then as we go throughout care, we're doing neurological scans and assessments that let us measure and track how are we adapting to stress? How is your nervous system changing? How are you healing? And what's the next layer of that healing journey look like? So the scans dictate the plans. We don't guess, we test. So many other corny dad jokes that I could get into. That is the key. And whether you're a pregnant mom or you're a fresh newborn, adjustments are so gentle and so specific. That's another reason why this needs to take place in a pediatric focused, prenatal focused environment is because adjusting a baby, adjusting a pregnant mom with all of the challenges that these come with, it's not the same as that typical chiropractic approach. So we've got to address the nervous system. We got to unwind those foundational challenges to get at the root of these issues. So regardless of where you're at in pregnancy, regardless of what your kid's dealing with, if that's something that you feel like needs addressed, please reach out. Give us a call, DM us here, reach out in any way that you want to so we can schedule that appointment, so we can set up that initial scan and evaluation and start clearing that foundational stress, start getting them back online. Guys, I hope that helps. Please let us know if you got any questions. Can't wait to meet you soon and help your family thrive.